Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We're so happy that you chose to spend some time with us. We have a very timely talk today. It actually just worked out this way. We are going to have a very dynamic young man Dr. Armin Henderson, who's going to talk with us about his work in Miami around communities of color, vulnerable communities of color, and dealing with climate change and natural disasters and how we can take care of ourselves. And we also will be having a speaker who has lived through the last couple of weeks of Fiona in Puerto Rico. So you see, we have very timely topics today. And without further ado, I will turn it over to our founder, Dr. Randall Maxey.
Good afternoon, everyone, and thank you, Dr. Barbara Neighbors-Stevens. Thank you, Dr. Ivan Walks, and thank you, Dr. Jocelyn Hines, and welcome, Dr. Henderson and Dr. Harford, who will join us by recorded interview. This should be a very momentous day when we discuss the natural catastrophes. A few weeks ago, we talked about the water problems in Mississippi. And as a follow-up, there have been a lot of patients or children that are in Mississippi who've had mental symptoms and psychological symptoms. And apparently, when they are boiling the water to kill the bacteria, that provides for a higher concentration of lead in the water. And some of those changes are severe. And to my understanding, many of those changes could be irreversible. So there's a lot that we have on our plate to look at with the safety of our communities, especially those of color, around the issues of water. Just a matter of news, mainly relevant to physicians. I read earlier today that there have been some criminal and fraudulent charges on certain so-called healthcare providers who were billing chiropractic services for sexual activities of dock workers, and to the tune of millions of dollars. So word to the wise, we should use Medicare appropriately. So we're going to start with our program. I'm very excited to hear from Professor Henderson and Dr. Neighbors-Stevens. And if you would introduce him, we can get started.
Thank you so much. It is my pleasure to introduce Dr. Armin Henderson. Those of you who are with us every week may recall a few months ago when we had Dr. Mark Mitchell on talking about environmental issues. We mentioned that there was this fellowship that had been created for physicians to pursue their interest in climate change and environmental matters. And Dr. Henderson is one of the first graduates of that program. And so we're very pleased to have him today. He is a native of Philadelphia, product of Meharry Medical College, and did his residency at University of Miami-Jackson, where he currently serves as part of the faculty of the General Internal Medicine Department. But I love the way he describes himself. He describes his activities. He's a hybrid. I never would have thought of that. I think you're just living the life that many of us live. We have all kinds of irons in fire. But seriously, he's very productive in his community, working with those who are unsheltered, helping the vulnerable community address disaster preparedness, street medicine, gun violence, and last but not least, the social determinants of health. So without further ado, I will turn it over to Dr. Henderson.
Hello, everybody. Thank you so much for the introduction, Dr. Stevens. I am going to do a little presentation from a guide that I made actually in the fellowship with that you mentioned earlier. If possible, I'm going to share my screen really quick. And if you could, you can drop the link of the guide into the chat so that maybe people can have it for later on as well. It's shareable, so it should be good to share. Can everybody see that, Brian?
Yes.
Okay, great. So basically, as part of my fellowship with the National Medical Association, I focus my efforts on a disaster relief team and this guide that actually was supposed to serve as like I guess it's like a guiding light for individuals who are health professionals, but also how to bring institutions as well into the fold when it comes to climate change, environmental justice, specifically dealing with people of color and in communities of color across the United States. So basically, I'll start with saying that, by answering the question, why is there a need? And so according to the National Advisory Council that was created after the aftermath of Hurricane Katrina, which was something that we all seen on screen take place. It was grotesque the way they treated these poor and Black communities in New Orleans. And basically, what they came to the conclusion that they came to is basically that they didn't want this to happen again. And so, they made all these guides and resources that they put out, and they basically said that our United States government does not do a good job of responding to communities in crisis. And every couple of years or so, they come out with these documents that basically outline all the things that the United States government is supposed to do. And yet each time that there is a disaster that involves particularly people of color, and I'm sorry, there's an echo. Can somebody help me get rid of the echo? Okay, great. That's good. And every time there is a crisis, particularly in communities of color, we've seen the same type of treatment. I know there's an individual who's going to be here from Puerto Rico, but during Hurricane Maria, you had Donald Trump, hurling paper towels into the crowd, and there have been significant other crisis events that have happened since, in which we've seen our government not really respond to poor and low-income communities, particularly those of color, the way that they respond to other well-to-do communities as well. So there's definitely a need for disaster relief teams that specifically focus on communities of color. And so one of the reasons why, or some of the reasons why I started a disaster relief team basically was after Hurricane Irma. I saw firsthand that our local government was not really responding to the communities here in Miami that are Black and low income the way they were other communities as well. And so basically some of the reasons why I started a disaster relief team was to educate people about the effects of climate change and specifically what the effects on health are, the decrease to utilization of inpatient services during crisis triage, the advocacy needed for change in public health policy, education of vulnerable populations about preventable deaths during disaster, and equitable resource allocations of hospitals and medical anchor organizations located in vulnerable communities. And so basically throughout the rest of the guide, I really talk about what it takes. And I want to mention that my disaster relief team is basically the medical arm of a whole multi-level organization of community partners that come together. And there are lawyers, there are community advocates, there are social workers, people who do food distribution and things of that nature, who also participate in what we call the Community Emergency Operations Center. And just a little plug, we have a hurricane that's basically we're now out of the cone of uncertainty in Miami-Dade County. But our Community Emergency Operations Center has activated, and we basically serve as the community level arm of the Emergency Operations Center on the county level as well. But we respond to individuals that are in other states. We respond to individuals in other countries. And we'll continue to do so. And this kind of just serves as a blueprint. So just some of the things that I think are important are relationship building through mutual benefit. Each community organization in our coalition is so tight knit that we have MOUs with each other that allow us to freely share information, grants, and other resources to respond to impacted populations, and develop similar ways to basically respond to vulnerable populations. Now, as of last year, a large community funder called the Miami Foundation has come on board, and now they serve as like our grantor organization for emergency funds should a disaster strike as well. And so our mayor is on board with what we're doing and things of that nature as well. The other thing that it takes is training medical professionals to be organizers. One of the things that I like to talk about is that, doctors, because we are now employees of large major hospitals and businesses, we really have to step outside of our role in the hospital and really engage with the community by knocking on doors, by being available for individuals. And I know people are saying, well, that's just another thing that physicians have to do. But if we're really, invested in solving the social determinants of health, in which climate and disaster is definitely a threat multiplier to the social determinants of health, we really have to step outside of those hospital doors and into the community. And so Dade County Street Response, which was the organization that I created, the medical arm of the Community Emergency Operations Center, it was created as a result of thousands of people who were serving in the community who said directly that they wanted access to medical professionals during resilience efforts. The other thing is investment in infrastructure before crisis occurs. So I'm going to just talk about some of the things that Dade County Street Response is involved in on multiple levels. One of those is, we have a street medicine team that serves to basically as large case de facto case managers for our large unsheltered population in Miami-Dade County. But we also do wellness checks and things of that nature and connect them to other health services. We do monthly Stop the Bleed and CPR workshops that we engage individuals and give them information about gun violence and things of that nature with the help of Dream Defenders, which is another community organization. We have an alternative to 911 mobile crisis line that launched 4 months ago that specifically serves to respond to people who are having mental health emergencies. We also have a free urgent care center where people can come and use whatever and get whatever services that they need for free. And in 2022, sometime at the end of the year, we plan to launch a sobering center to decrease hospitalization and incarceration of those with alcoholic intoxication and other substance use disorders as well. And all of these things continue to run during disaster, which I think is very important to mention. The other thing I think is important is identifying existing local and non-local emergency resources. A lot of times what I've seen specifically during Hurricane Irma is that all of those federal qualified health centers and things of that nature tend to shut down when there is a disaster. And these are the organizations that basically serve the most vulnerable populations. And I feel as though they need to be funded and basically energized during moments of crisis. And so identifying who those organizations are, what resources they need, and advocate for them to continue running on that basis, I think is very important. Outside of that, a lot of local and state municipalities have really good resources. The problem is that sometimes they don't have credible messengers. And so getting to know what those resources are, so that you're able as a provider or just a community member to advocate and to share the information with other individuals, I think is very, very important. Establishing and engaging a strong volunteer base, I think, is important. Obviously, determining the area with the greatest need. We usually focus on the zip codes that have the lowest life expectancy. And so we pretty much weed out a lot of the other, well-to-do communities by saying, look, we're focusing on those with the greatest need. And so throughout the guide, I hope, as you read it, it's very short, that you get some, good tidbits about how you can be involved. I think from a physician level, an executive level, and also from a community level, there's a lot of good nuggets in there that I think people can get information from. And so I'm happy to share it with you. Again, it was part of my, Climate and Health Fellowship as part of the National Medical Association. And, if there are any questions, feel free to reach out to me. And I'm going to stop sharing now. Okay, great.
Okay, I think Simon did a great job of muting us all. So if we can get unmuted, Dr. Neighbor Stevens.
I'm
go.
now, I'm unmuted now. Yeah.
Good.
Thank you
Well,
so
thank
much,
you.
Dr. Henderson. That was a wonderful presentation. And not only a presentation, but an initiation of a dialogue, because you certainly highlighted a number of points. And I think that that you are a wealth of information. My first question, I mean, you made the point that this is a coalition of several different organizations, but can you go a little bit more in depth in how the disparate organizations were able to come together and form the coalition? What was it that brought them together? What keeps them together? And how does one, if you're in a community where there are probably similar kinds of organizations, what can you do to try to pull everybody together into some coalition that is able to do the kinds of things that you all are able to do with the Dade County Street Response Team?
Yeah, so I think it's very important to mention that the nonprofit industrial complex it's a business, and so naturally people are trying to pull together their own resources, and they pretty much act like that if you share resources or information with another organization, that you're basically giving them access to funding and things of that nature that they normally wouldn't have had. And so we throw that out the window, and we say that we should be sharing information, we should be sharing resources, specifically during times of disaster, because the populations that we serve that often overlap, they are at the most vulnerable time during a crisis. And so, I think it is important to have leaders who are trusted, to have organizations that are trusted. It just so happens that in Miami-Dade County, there's a young woman named Valencia Gunder, who is from, I'm not from Miami, I'm from Philadelphia, who's from the community that we're serving, and people trust her. So when she says that, that we need to, stop acting like we can't share resources, then that's what we do. I also want to say that Miami is it's different than a lot of other communities, because we go through disaster every year. And so every hurricane season, we always see the same cycle of, poor and low income and Black communities in Miami-Dade County just not prepared. And at some point we just were like, look, we can't continue the same cycle, and we can't wait for the government to say that, they're going to help us respond. We just basically went out and did it ourselves. And since then, we've been able to basically, this Community Emergency Operations Center, this model, we've been able to export it to other places across the country as well, under the leadership of Valencia Gunder. And so what we hope to do is, we were supposed to be going to Egypt to present our findings at the COP conference, but we also think that this model is adaptable for other people, not just across the country, but across the world as well.
Now, Dr. Maxey is muted. So while okay.
Would somebody be kind enough to mute that radio that they have playing that's interrupting the speaker? But one of the questions I have, and you partially answered it, it seems like most of our communities would benefit from having a structure similar to what you presented. Not that I'm not interested in Egypt and other countries, but we need things like this in our homes. I know they need it up there in Nashville and Memphis, but we need it out here in Los Angeles. How can we have something like this to face inevitable disasters that we don't know when they're coming, but we know they're coming?
Yeah, I mean, well, first of all, I want to say that it's not just natural disasters that are happening that need this sort of infrastructure. It's man-made disasters as well. Oil spills, when a government decides that pipes shouldn't be retrofitted so that leaking doesn't occur in places like Houston, where the temperatures dropped dramatically and we saw, major floods there. And so, these type of disasters are going to continue to happen. And Black and poor and disenfranchised populations will continue to be heavily affected. And so, yes, I do agree that this type of infrastructure is needed at other places. And it just so happens that the young lady, Valencia Gunder, as part of, a pitch to the government, you've heard of the Green New Deal. I think there's a Red New Deal as well, or something like that. But she's calling it the Red, Black, and Green New Deal. And she's pitching it as part of the movement for Black lives. And we're going to be presenting this to politicians, in Congress and things of that nature that specifically focus on funding for training people at the community level, like block captains and things of that nature, to give them the resources that they need to respond to local disasters, to local communities. Because the other thing that I want to say is that Miami is different than Los Angeles, and it's different than North Carolina and Philadelphia. And so we want people to learn from us, to take what they need from the structure that we have, and then to export it to where they are and to make it their own as well. We're focusing on things that are hyper local, and of course, we're making blueprints, and we're making policies and procedure guides. But what we're hoping is that, or what we think is that, it shouldn't spread like a corporation across the nation. We want people to pick it up where they are locally and basically take what we've done and continue to expand on it as well.
Yeah, how are you going to do that? How are you going to make sure that happens?
Well, we're making guides and policies and procedures and things of that nature that we're making open source. And of course, people can come here, they can see what we're doing, they can ask us questions. We're having open discussions about it, that we're able to export to large groups of people. And yeah, I mean, through that way, we want people to step up and take what we've done and export it to where they are. But as I said, this guide that I have is open source. Like you don't have to pay for it. We're going to continue to release things like this. I think Valencia released like an Arctic blast report and things of that nature. And so what we're really advocating for is that local governments are able to fund local community leaders to pick up and do trainings and things like this, so that they can have a similar infrastructure locally where they are as well.
I wanted to ask you about some of the work you're doing around the dangers of heat, because parts of the country that have never had to really be concerned about extreme heat are now facing extreme heat periods. So this is one of many things that are affecting our communities disproportionately. Our communities tend not to have air conditioning. We don't have a lot of green space, all of the things that contribute to the heat emergency. Can you talk a little bit about what you all have done? Because it certainly gets hot in Miami, but really I'm raising this because other parts of the country now are really having to deal with the heat emergencies.
Yeah, I mean, I think that this is a really hot topic in Miami-Dade County, of course, because it's really hot. But also because we have a large unsheltered population who spends a lot of time outside. And as we have this housing crisis that is really took over the wave of Miami. Miami is like one of the most expensive places to live, but also like housing and rental prices across the United States have gone up while wages really haven't increased like that either. And so what we're going to start to see is a lot more people having to bear the weather in places like Miami and other individual places as well. And so what I've been advocating for on a local level is that we need infrastructure specifically to our local government. We need infrastructure that pretends that pretty much, I guess I'm trying to figure out how to say this. There's a saying here in Miami-Dade County, or people, there's a sentiment in Miami-Dade County that if you provide things like bathrooms and resting places and things of that nature for people who are outside, that it encourages homelessness. And so I'm a proponent of that. I don't find that to be true at all. And so what I'm asking for our local government to do is provide spaces for people to rest, basically. The sobering center that I mentioned that we're supposed to have open before the end of this year will also serve as a cooling center as well, a place that people can just come get some water, sit down, and then, keep it moving once they, body temperature gets back to a normal level as well. It's hard to talk to a local government to talk about these things as well. So, I mean, in the meantime, we just try to create spaces where people can just rest. So we set up like tent areas, large tent areas that people can come in, get food and things of that nature. During COVID-19, one of the things that we did was that we set up a hygiene site where people could take a shower, wash their hands, get some shade, get water and things of that nature as well. But I think you'll start to see a lot more of those pop up, specifically in places that are really warm outside, especially because places like Miami-Dade County doesn't have enough room to put all of the unsheltered people. And then hopefully, these will also be places that other individual, people from the community can use as well that are not unsheltered. I also think that, we should be advocating for people who rent, there should be some sort of standard around air conditioning as well. But I mean, there's so much to talk about. Energy has gone up, and things of that nature. And so can people afford to have air conditioner all year round when the bill is so high and things of that nature as well? So, I mean, I'm on the street level, we're just going to provide, cool places for people to cool down, covered places like tent areas and things of that nature. We'll provide water until, our government figures out what they want to do.
So Dr. Maxey and Dr. Neighbor-Stevens, you guys have been just fabulous, but can a brother get a turn?
Of course.
Okay, thank you. First of all, Dr. Henderson, fantastic, just fantastic. I think that the more we can get out of our offices and into our communities to serve in the way that you're serving, I think it's huge in so many ways. Number one, it allows us to connect and really see what's going on from a public health perspective. As a former state public health officer, I think it is wonderful. I had a specific question I wanted to dig into. You mentioned that part of what you all have put together are these sobering centers where you can have people come in and get sober. As we know, many times that involves monitoring of people, and it involves medicating people so that they can safely allow the toxins that they've put in to leave their bodies. And then most importantly, if we're going to do something that is going to help them long term, there has to be a relationship between some other longer term care. So I just wanted to hear how you put that together, because so many folks are struggling with abuses of all kinds of substances. How did you put together this opportunity for them that's going to be able to monitor them safely, medicate them safely, and then transition them to someplace else?
Yeah, that's a good question. We don't have it off the ground yet, but we plan to have it before the end of the year. One of the resources that I think we don't really tap into as medical professionals is peer support specialists. So we have a group of 15 to 20 Black men who have all gone through, substance use problems at a variety of levels, who serve as they're going to be the de facto like workers who will pay to pretty much, be there and manage the sobering center at all hours of the night that it'll be open. But in addition to that, Dade County Street Response is a free clinic noted under the Department of Health. We have multiple partners, including Jackson Memorial Hospital, University of Miami, and other entities that we're able to tap into our resources and have people volunteer and things of that nature and serve as faculty members and things. One of the things that I'm working on right now is an educational component that we're inserting in the medical school and in the residency program as well. And so one of our partners is the Department of Psychiatry. So we're going to have, psychiatry residents and faculty members who are going to be there to help, administer some of the medications and things that they need. But also we're working with the local, organizations that already do this, like, the local, they're not sobering centers per se, but they do offer services that can be offered in a sobering center as well. It's just an alternative means. One of the individuals that I think is doing really good work down here is Hansel Tukes. He runs the IDEA exchange. And as part of his NIDO exchange program, one of the things he also does is he's able to get people buprenorphine in shelters. And so this is also something that we want to have at the sobering center as well. So we'll be working with him in addition to other individuals to bring this to fruition. It's not like a one-stop, it's not just my organization by itself. It's going to take a partnership. And I think for the most part, we've identified multiple players who want to be involved from the community level all the way up to the institution as well.
So let me just toss one other thing in. You mentioned, Dr. Henderson, that a lot of these things are maybe in lieu of or in addition to the local public health getting their act together. And one of the things that I would really encourage, and I agree with you that sometimes it's hard to do this, but to establish relationships, and maybe part of the new training in the medical school and in the residencies can be in connecting with the local departments of health so that those relationships are there as soon as possible. And it does two things. Number one, you find out what they're doing. What are they thinking about? What are they planning? Not only what's just in place, and then see how you can be part of that planning they're doing. So I just wanted to toss that in. I'm sure you're doing that, but formalizing it in terms of an education process so the residents come out knowing this is a priority, this is something we taught you to do, so let's make sure it's done. I think it can just be amazing. And then you're connecting literally the community with the people that are supposed to serve the community at that government level. So just, major kudos to what you're doing. I think it's so very important.
Thank you so much. And I'll definitely incorporate that. That's a good idea. Thanks.
Well, thank you so much, Dr. Henderson. I hope you can stick around. We're going to do a podcast interview if we can get it planned and round out our discussion of disasters and problems.
Okay.
Is there anything in the chat, Dr. Neighbor Stevens or Dr. Walks, that we need to address?
Not at the moment.
Okay, Simon, if you can play that video of Miss Harford. Miss Ruby Harford is a PhD in nursing care. She's been a critical care nurse here in Los Angeles. She obtained a Bachelor of Science in Nursing. She did a Master of Science in Nursing, and she also did a doctorate in nursing, specializing in renal care. She took over as the Chief Compliance Officer of a dialysis company that was purchased in Puerto Rico. She rose to become CEO and president of that group, which she now serves. They have over 17 current dialysis centers taking care of more than 2,000 patients in Puerto Rico. And they're the second largest company in Puerto Rico, the seventh largest in the entire United States. So let's go to that video and then we'll discuss it. Record. Now it's on. Good morning, Dr. Ruby Harford. How are you today?
Fine, thank you. Good morning, Dr. Maxey.
Good. I understand you're on the way to Puerto Rico in the middle of a storm. Is that true?
On the way to Puerto Rico, en route to Puerto Rico. However, the storm, Fiona, has left, but we are now faced with the recovery mode of the, recovery of the Fiona, the post-catastrophic challenges that we have now with the mudslides, the flooding that has been, across the island. Some areas more hit than the others.
Yeah. So set the stage for me. I know you are the Chief Executive Officer and President of Atlantis Healthcare, and what actually does that mean? What do you do in Puerto Rico?
I, as the Chief Executive Officer in Puerto Rico, we manage and operate the largest locally managed dialysis program in the island of Puerto Rico. We are
Wow.
second to, I'm sorry?
I said, wow.
Oh, and we're second to the largest other provider, which is a publicly traded program in the world. In my role, I am responsible for 17 units. We manage 30 hospital contracts, 3 training centers, and I'm also very involved with Washington, D.C., with HHS, Health and Human Services, as well as CMS in New York, which is our regional office, in advocating for policy modification and edits to Puerto Rico when we look at healthcare policy as it relates not just to all the U.S. territories, but the effects that we are challenged with in Puerto Rico are typically the same similar challenges that the type of the demographics that we have with our residents here, underserved, being a minority, being Hispanic primarily, that other similar ethnic groups as well as underserved areas suffer within the mainland U.S. and other U.S. territories such as Guam, American Samoa, and Saipan.
Yeah. So how many
we do a lot of policy advocating.
So how many patients are you responsible for, and why is a natural disaster like a hurricane so devastating to a place like Puerto Rico?
I'm responsible for close to, at this time, 2,000 chronic disease patients, which we service on the island. And we have about 3,500 plus patients that I'm responsible for in a chronic disease management program that focuses on pre-diabetes, diabetes, and pre-ESRD. And again, 30 hospital contracts that we manage all the acute programs. So it's quite a bit in managing these patients.
Now, when I think of Puerto Rico, at least before I started going there with you some years ago, I just heard about San Juan, which is a metropolitan city, and there's beaches with white sand. Is that Puerto Rico?
Yeah, Puerto Rico is beautiful. We have a lot of beach areas, but many people don't know that Puerto Rico is really an island, a chain of small islands, has smaller islands that is made up, the topography of it's a very mountainous terrain area. So with narrow, what we call narrow valleys, but it's an island, but we have a very large mountain terrain, and we have the only within the U.S. What is it, Dr. Matthew? The jungle. We have one of the jungles there in the U.S., which gives us a lot of tropical rain and weather as well.
So what are some of the main challenges? A lot of people don't really know what dialysis really is, but why is it a challenge in Puerto Rico, and especially after a natural disaster like this? Our topic for today is natural disasters. Why is it such a problem in Puerto Rico? What do you face every day when you wake up?
Well, Puerto Rico is as a U.S. territory, as one of the major 5 U.S. territories. We are geographically remote from the mainland, and our closest state truly would be Florida. And being geographically remote and under the Jones Act, as you know, Dr. Maxey, we worked with this on the territory of Guam. There's a lot of policy restrictions regarding how we get access to using transportation, our goods to the island, and also, this increases the cost overall of managing healthcare programs in general, or just the entire island, the economics of the island. The other thing is Puerto Rico is the largest U.S. territory, and we have about 3.2 million residents on the island. We have a very frail electrical grid program, and in also Puerto Rico, our primary language is Spanish and not English. So it's a lot of unique things in Puerto Rico when people think of Puerto Rico. It's a tropical island. Unlike Honolulu, Hawaii, on the West Coast, people travel to Hawaii. which is primarily English speaking. It's a large state, a lot of revenue being generated in that state, very strong economy. Puerto Rico is a U.S. territory with a very poor economy right now. We have been 10 years plus trying to struggle getting our economy back to being strong. But then when Hurricane Maria hit, we were then impacted again by the post-recovery efforts from Maria, which, as you know, was one of the worst natural disasters which hit the Caribbean islands in many years, and we got hit with 2017. So when you look at that, when you put in frame it so that you look at Maria, post-Hurricane Maria, which was in 2017, still recovering. We never fully recovered, with a very poor electrical grid, and the electrical grid is what helps to operate cleaning and processing our water on the island. Then we look at what happened in Fiona this past Sunday, and basically this Sunday when we were hit with Fiona, while we didn't get strong winds like Maria did as a Category 4, with Fiona 1 we were hit with not strong winds, but basically 48 to 60 hours, which is really 3 days of a storm that just basically hovered over the island, which ended up resulting in, again, with the floods, major floods, catastrophic floods, and flooding.
Wow. So quickly though, tell me a bit about water problems and power problems in your dialysis center. What are your challenges there?
With regard to diesel, we have been pretty resilient in having an emergency backup plan that we have co-generator systems. And Dr. Max, as you know, thank you very much. That was your idea in implementing that program in Puerto Rico when you came in 2017. So thanks to the co-generator system, we were up and running in the dialysis units because of the co-generator within 24 hours. All our units were 100% operating. While we started late, we were still able to treat patients.
And that would not be in me.
So diesel is number one. You need diesel when your power goes out to be able to run these programs.
So you get big old generators, right? Each dialysis center has more than one generator, right?
That is correct. If we don't have more than one, we are hooked up to a hospital main generator, which has priority during a disaster. And so we have immediate access to electrical via the diesel. That is correct.
Okay. But your most other problem that's difficult is water purity, right?
That is correct. Especially water from the municipalities that are served. The municipality would be equivalent to our counties, like LA County, Orange County. And so post Fiona, post Maria, we have water that has been contaminated. There's a lot of sludging in the water, what we call in Puerto Rico turbidity. And what that really means that the water is so thick with contaminants, with mud and bacteria. If we get the water, it may not be usable, or the rejection has to be a lot higher. Typically, rejection is about 30% in Puerto Rico, in dialysis units. And much of the water we can't use, or we have to assess it before we can even put it through our system, because we don't want it to damage the RO system.
So
you know that.
Explain this, and a lot of people don't know what dialysis really is. So you do primarily hemodialysis. So does that water actually go into the body? Why does it have to be so pure, and how do you purify it?
We purify using what they call AMI guidelines, which are set and implemented by Centers of Medicare, Medicaid. We have to have purified water to make sure that the water is clean, not contaminated, and it's a very sophisticated purification system that we use for water dialysis, for the treatments for these patients. If the water is so contaminated or so what we call turbid, we cannot use that water, and then we'll have a water shortage, and we have to wait possibly for a new tank of water that is much cleaner and less turbid, so that we could run it through the programs, through the dialysis unit in order to be able to dialyze.
Well, I certainly thank you, and I wish you the best of luck with what's going on there. And I have one last question, and is there any way that we can help. We have a nationwide, in fact, a worldwide audience. We stream live on Facebook and YouTube and whatnot. Can we do anything, or can we just continue to pray for the welfare of our sisters and brothers in Puerto Rico? What do you think?
But definitely prayers are always great, but I would highly recommend that for those who have influence and can help, to really understand what happens in Puerto Rico to the patients, to all residents, and especially with Medicare and Medicaid, because Medicare and Medicaid sets the golden standard for insurance policy and process at the national level, and it also impacts the U.S. territories. There's not a lot of focus that goes into the U.S. territories, and the bulk of the U.S. territories are basically considered underserved areas or areas that are so remote that we have very unique challenges, but not so unique in that they are very similar to the rural areas that we see in the mainland U.S., the continental U.S. And so the type of folks that we have, the residents in these rural areas, they are mainly impoverished that we see, so geographically remote from what we would call the main city centers for hospitals, even including dialysis units, Dr. Maxey, that we should be looking at including territories as part of the discussion when we talk to MedPAC, MedCAC, and also to our congressional and senatorial groups that really have impact and can influence change in policy to the U.S. territories. Because again, what we see in challenges in healthcare, are very similar, if not the same, in the rural mainland U.S. So the things that we need to be looking at when we look at natural disasters, looking at policy, sustainability and challenges, we need to look at equity, we need to look at sustainability, and we also look at resilience. So in other words, when we look at policy changes and policy improvement to the territories, which again, I emphasize is very similar to the rural areas of the mainland, 3 areas we need to be looking at is for policy is how can policy be, sustainable, equitable, and also resilient during the times of catastrophic disasters and as well as non-catastrophic disasters, because in the end, much of what happens in natural disasters impacts people's lives, whether it's mental health or clinical or exacerbated chronic conditions for years to come as they also begin to recover physically and mentally from these disasters.
Well, I certainly thank you. And just as a reminder, the population in Puerto Rico, they're all United States citizens, right?
That is correct, 3.2 million people.
Well, good. Well, thank you, Dr. Ruby Harford, for being with us. We will invite you back when you're not traveling to Puerto Rico and going into danger, I say. So keep your chin up, and thanks a lot for being with us today.
Thank you, everybody. Thank you, Dr. Maxey. Thank you for having me. And I look forward to re-meeting again.
Thank you. Bye-bye.
Thank you.
So I want to again thank Dr. Harford for coming on. As I spoke with her after the interview, I asked, what is the thing that those patients there need the most? She said what they actually need and want is socks, just plain old socks. And I told her I'm going to put my address in the chat if Simon would help me. And for anybody who wants to give something, we would love to send them socks. They get cold on dialysis. They're often wet coming from home, and we can supply them with some socks. Don't need anything big, don't need anything expensive, but socks. They also use those little things you play music on. What do you call them? Not iPads, those, whatever they are, little things the kids use to listen to music. And that would be very helpful. So my address, if anybody wants to donate socks or something, is 418 East Arbor Vitae Street, Inglewood, California, 90301. If there are any questions about Puerto Rico and the dialysis center, I'd be happy to answer. And I was there during Maria and got a chance to go up into the mountains and where some of our dialysis centers are. And it was devastating enough to make you cry to look at what they go through. And our great infallible president at the time was throwing paper towels at the people of Puerto Rico. What are you going to do with a torrent, a flood, and a tornado with paper towels? So anyway, thanks a lot.
Maxie,
So,
may I, Dr. Walks?
yes, ma'am.
I have been musing over something that I heard someone say earlier today, which was can't has to be taken out of your vocabulary and substituted with how can I make this happen? And it seems to me, every week we've been talking about different topics that all seem to come back to the same point. And that point is that we are going to have to take charge and make people do what needs to be done. Now, I am not trying to speak for anybody else. I'm just speaking for me. But we have known, we could spend 2 hours going down a list of all of the atrocities that have occurred in various communities on the mainland and off the mainland that people are getting away with. And the people that are getting away with it is the government. So as we are moving toward our election time, it is even more critical than ever for us to not only vote, but hold people accountable who are put in various positions. There has never been a time more critical for us to start exerting the force of the community than now.
Well, thank you. Dr. Walks, you were going to say something?
Yeah, I was. First thing I want to say is that I wish we had time to just put on a loop the comments that Dr. Barbara Neighbor-Stevens just made, so it would play again and again about 8 times, because it is so important that we deal with those folks that we're voting for. Let me say this about that. So often we are unhappy with the government, and I think this, for me, this goes back to the really amazing work that Dr. Henderson talked about that his folks are doing. I was deployed as part of the federal government. I was a federal government emergency response person. I was deployed down to Hurricane Katrina and saw firsthand the just awful things that happened after having just run the New Orleans Marathon before and seeing a totally different place, and now coming back and it was so different. But I went to Pascagoula, Mississippi, and something happened that I've never forgotten. They set up shelters for people to come to on one of the cruise ships, something they were talking about on the news recently, using cruise ships to house people. But they told folks they could come on the cruise ship. And I remember a gentleman who was a machinist and had managed to save his tools from the hurricane. And they told him he would have to leave his tools outside if he was going to come on the ship. He couldn't bring his tools. And I remember talking to the FEMA person and saying, the end of it is we got the man and his tools to a safe place on the boat. But I think what it speaks to is the need for someone in the community to just be, I'm going to be the person whose job it is to connect with that government infrastructure, with that local, and then whoever comes in when the feds come in, somebody that knows and understands the needs of the community. As the CEO you were just talking with, Dr. Maxey, someone who knows the community has got to take it upon themselves to be able to be that translator, to be able to communicate what the community needs to the people who have the resources. The federal government of the United States of America has basically unlimited resources. There's never been any problem anywhere in America that couldn't get solved because America didn't have the money. It just hasn't happened. People have said we didn't have the money, but it just hasn't happened. And so I would just encourage us, as we are pointing out all the places where the government needs to do better, as we're pointing all of those out, we have to find a way to communicate with those people in a way that makes them want to do something. Because you know what? When they do something right, we're going to give them the win. We're going to cheer for them. We're going to make it in their interest to do what we need. We just have to build that relationship. So everything Dr. Neighbor-Stevens said about voting and holding folks accountable is important. And at the same time, while we know they aren't doing everything they should, we've got to help them communicate with us. It's the old help me, help you kind of thing, because otherwise we're at odds. We're always talking about how bad they are, and they don't. And those individual people don't really have an interest in jumping into a fight with us. So
let me comment. First of all, I agree with everything that both you and Dr. Neighbor-Stevens have said. So I asked Dr. Harford, why hasn't there been more than $40 billion approved for Puerto Rico after Maria to recreate and fix the infrastructure, the electric grid and the water system, but less than 10% of that has been spent? She said, because they didn't give it straight up. It's a matching fund. So in order to get $40 billion, somebody has to donate $40 billion. So the government does things in ways that minority people can't live up to because you don't have the money to co-donate. So it's not like a straight up grant to fix the problem. The other thing is there's other crooked things in politics. Ruby mentioned that I bought 14 generators to the island, but we couldn't get them down. The federal government would not approve us to lease planes to carry the generators down. The way we did it, you recall that occasionally Admiral David Brewer is on this call, and Admiral Brewer was in charge of the US Navy logistics. And he was able to introduce us to the general that was in charge of the logistics for Puerto Rico. And we were only then, allowed to lease one of those big 767 planes to bring in our supplies and generators. We had to go through all the political hoops. So you're very right, Dr. Walks, that we have to use our connections. But why do we always have to fight? We need some powerful advocates to help us do this. And not only the people in Puerto Rico, the people in Mississippi, the people in Miami-Dade, we need to have a better way to use the levers of power. And hopefully we can learn some of that from our politicians, our Congressional Black Caucus, from people like Dr. Armand Henderson and others. So we need some of that expertise, and we've got to be able to challenge ourselves, not to just highlight the problems that are out there, but how can we help address successfully and fix them?
So Dr. Maxey, I agree 100% with what you're saying. And I guess now my age is going to show, but these are lessons that we learned and implemented through the 50s and the 60s. These are not new concepts. I am frustrated that we are, I'm not saying that this is what you said, but it's coming across like these are problems that are new and that we haven't been able to successfully address before, but we have. Now, I don't know what happened. I'm not a psychiatrist and I'm not a sociologist, so I can't probably analyze it correctly, but I suspect some of it is complacency and being lulled into a false sense of achievement based on the achievements that we were able to enjoy after the work of the 50s and the 60s. We have got to regain the energy, the ingenuity, and the aggressiveness of just a generation ago to move forward and make this country be the place it should be for all of us.
That's true. I invited Simon, if you could unmute some of our attendees. I'd like to discuss it. I'd like to call on Mr. Brooks, who led one of the most influential Black organizations in the world. Their membership included the major executives that were Black of Fortune 500 companies. I know that Dr. Exelana Bean is a department head at Meharry, one of the world's foremost pediatrician. Dr. Jesse Sherrod, but speak up. I'd like to hear how can we address some of these things? We've got a load of community and lay talent as well as professional talent. I'd like to hear from a few of you in the few minutes we have left before we sign off for the day. Does anybody have their hand up, Dr. Walks?
Mr. Brooks is unmuted, and you did call on him first.
And I think Dr. Gibson had a comment too.
Randall, I think that the comments by you and Barbara are right on. We keep sitting waiting for everybody to help to fix our problems. They don't care about our problems. They've shown us that they don't care about our problems, but once we become aggressive in trying to find a solution, then they will jump on board. It's got to be time that we rally all these, not just medical, but executives, corporate, and bring together some kind of coalition to do that. We got an ELC annual meeting coming up on the 6th of October, and they've been canceled because of COVID for the last couple of years. I'm gonna talk to a couple of people during that meeting to find out what are the ideas and thoughts on things that we need to do. We got to stop talking about it and figure out a way that we can work and partner with the national medical associations and all that. We got to put our heads together and figure out how we can help ourselves, because white people ain't gonna help us. They're gonna do what they got to do and do the minimum that they can do for us, but we got to do it for ourselves.
Where's that meeting gonna be, Dr.
It's gonna be right. It's gonna be right in DC.
Okay, ELC in DC. That sounds near Dr. Ivan Walks.
That sounds very exciting. Dr. Maxey, I want to make one quick comment about something you said with Mr. Brooks's organization. They're not just one of the most influential Black organizations. They're one of the most influential organizations that just happens to be Black. They are absolutely influential, period. I just want to make that clear.
So do you know, and Carl, I'm putting you on the front seat, but do you know who Tark Brooks is, who's the son of Carl Brooks? Do you know who he is, Dr. Walks?
I do not know that, Dr. Maxey.
I'm gonna let Dr. Brooks tell you who his son is. This is an idea of some of the power we have on this phone call right now. Who is your son, Mr. Brooks?
He's the president and CEO of Combs Enterprise. It was
Of
an
whose
800
enterprises?
Combs Enterprise.
Who is Combs?
Sean P. Combs had an $800 million business. My son has been there. He's taken that $800 million business to a $2.2 billion business.
So you're talking about Diddy Combs, huh?
Yes.
Okay, there you go. All right.
There you go. Well, no, Mr. Brooks, I'm happy to know you and happy to know anybody you want me to know and happy to be anywhere you want me to be. I really have enjoyed the work your organization has done over many, many years. So I'll leave it at that. Dr. Maxey, Dr. Clark had her hand up. If we can unmute Dr. Clark.
Is that the famous Dr.
There we
Michelle
go.
Clark?
Nope, a different Dr. Clark.
No, it's not Michelle Clark, it's Dr. Jolander Woodard Clark. And I'm so happy to be on this call. This is my first time having an interaction, but I'm so excited. God has a way of just bringing things together. I hope no one minds me just, putting that factor in there, the G factor for sure. I happen to be a physician, that's been in the Atlanta area for pretty much over 20 something years. And I happen to actually be from Jackson, Mississippi. So God has it to where I'm actually in Jackson, Mississippi at the moment, helping my parents. And I was here during the water crisis. So just again, I'll just reiterate what you all are saying. Some of these things that are happening are not new. These are not new issues, especially when it comes to our communities being able to come together. And how we are so detrimentally impacted by these disasters, be they man-made or be they natural. So being able to really form this coalition to be able to help ourselves, because one of the things I'm going to say that was given to me is when the cavalry comes, don't look for them to come for us. However, I have been assured that we have been given enough in our community to be able to save ourselves. So you can imagine my excitement about this call, to be able to see how all this can really come into fruition to make it a beautiful, viable vision that will help our people. We have enough.
Thank you so much, Dr. Clark. Dr. Bean, I think, is unmuted.
Thank you.
All I wanted to say was that as you pointed out, we have done this before. And we do know, for example, that starting at the local level and looking at the organizations and the people who have at the local area, for example, Puerto Rico, who have been fighting this fight all along, is usually the best way to start. And that if you find and you partner with the people that are there, with organizations which have been doing this, and then we add our resources and expertise to those people, both financial as well as intellectual expertise. A classic example is when you were talking about the generators and how to get them to where it was. I'm assuming that you knew, and because of your relationships and with people in Puerto Rico, they needed generators. So consequently, that wasn't a decision you woke up one day and said to your mind, I'm going to just take some generators. So when you work with the people at the local level, in terms of being able to make changes, really, that's usually the most sustainable way to make it, because we've, as you know, millions of dollars that supposedly have gone into to Puerto Rico have not gone into Puerto Rico in terms of making an actual change in the infrastructure in Puerto Rico. I'll just use an example. I have a project that I've been working with in Zambia. It's an HIV project. It's HRSA funded. But for the last 3 years, because of the pandemic, we have basically run that project very effectively. Dr. Matthew Juarez is the PI on it. I don't know if any of y'all know Matthew Juarez. She was in LA at Drew. She's now at Meharry. But Dr. Matthew Juarez, some really good partners, what we have been able to do is to use Zoom to set up a whole infrastructure based on using the people who are actually in the country to actually do the services. And it has been extraordinarily effective in being able to actually carry out very extensive projects with several health centers in Zambia and able to do it. And we've done it entirely by Zoom. So the one thing we recognize is that you need to put your infrastructure or start with the infrastructure or develop the infrastructure in the country itself. And of course, then bringing on board our friends and our leverage that we bring with us, the NMA, all of the other leverage that we bring with us to actually carry out those projects. But I think one of the things, again, is to identify at the local level who we can best partner with if we want to be effective in doing sustainable changes within the community. And that's a basic premise, which all of you folks who are in public health know from the beginning. So I know I'm preaching to the choir, but just to remind you that I am sure there are people in Puerto Rico who've been fighting this battle their whole life,
Dr.
and we need to partner with them.
Dr. Bean, thank you. And sometimes it's important to preach to the choir because the choir members might be the ones who will get out and do the work. And I think what you just said is a good example of what Dr. Clark was saying, that it may be more difficult, but what we have can get it done. And you just gave an example of how we can do that. Dr. Sherrod had her hand up, Dr. Maxey.
Yeah,
Go ahead,
thank you. Yeah, this has been a great discussion, and I just want to actually agree with most of what had been said, especially coming from Dr. Neighbor-Stevens, the fact that this is not new. And I wanted to shout out to the young lady, the young doctor from the Jackson, Mississippi area who is or was from Jackson. I went to Tougaloo College. So I'm from Mississippi, the Delta of Mississippi. But I think there are two things that we have to do. One, we have to garner our own resources. And like she said, we can do it. I think we have to also educate ourselves that we can do it. We have all of these athletes who have lots of money. And I think we should make an effort at bringing the level of consciousness and awareness to them of the things that they can assist us in doing financially. In disasters, but also in just building the infrastructure so that we don't keep repeating this cycle over and over again. And the second thing I wanted to say is that we have to also continue to be vigilant and activists, because when the money goes in, for some reason it goes awry. It's not used for what it's supposed to be used for. And I know that was the case in Jackson, Mississippi, and it seems like it happened in Puerto Rico too. So we need to talk about how is it that we can have some oversight of the money that's given to us, and then have our own addition to that, because although we can do a certain amount of it ourselves, we also pay taxes, and we do need help from the system, but we need to make sure that money is going where it's supposed to go, and build things that are sustainable and not just grant dependent. If you understand what I mean, permanent changes need to be made for these disasters that are occurring over and over and over again. Thank you so much.
Well,
And
thank you.
thank the presenters. They were really good.
Thank you, Dr. Sherrod. Which reminds me, the last time I saw Dr. Sherrod, we had a memorial service for Dr. Fred Parrott, who was a legendary physician, MD, PhD in Los Angeles, and he passed. But before he passed, he gave each historically Black medical school and Drew several $1 million apiece. But at that meeting, the leaders of all the Black medical school in the country, their presidents or presidential representatives were there, and Dr. Sherrod was on that program representing the fact that she founded a group called the Association of Black Women Physicians. So there was enough power in that room to almost do what we need to do. Dr. Sherrod, is that correct? Okay. So Dr. Neighbor-Stevens, anybody in the chat room we need to comment? And I think Dr. Gibson had a comment, if I'm not mistaken. And you don't have to be a doctor to comment anyway.
No comments in the chat right now.
And I don't see, oh, okay, Dr. Gibson is unmuted now, Dr. Maxey.
Thank you. I really have to revert back to our first guest, the things that he said about making it hyper-local. The solutions are hyper-local, particularly now when we look at the incredible amount of money being wasted, let me just say misdirected, when it could be directed to the needs of the people in Puerto Rico and Jackson, Mississippi, and that sort of thing. Millions and millions of dollars are being spent on what are called media buys. So I think what we need to do, in addition to educating the choir, to Dr. Walks's point, is we need to also address the fact that things get done through policy. And we have to, I think it was a caller from Puerto Rico that suggested if those of us on the call that have contacts with people or in contact with people such as politicians, policymakers, that's really where the rubber meets the road. If we can get to the folks that make the decisions as to how these monies are federal dollars allocated and the private dollars allocated, the venture capital and financial communities such as they are, that's where things get done. Thank you.
Oh, very good. So let's go with final words. Thank you, Dr. Gibson. Dr. Henderson is one of our honored guests today. Do you have some final comments?
Yeah, I mean, I guess it was great to listen to everyone. I want to just, make sure that individuals are reading the guide that I put out. It's open source. A lot of the things that you all expressed today are in the guide. I want to reiterate that, yes, these problems have happened over and over again throughout the course of United States history. And so my thing with Dade County Street Response and our Community Emergency Operations Center is that we're not going to wait for the local government, for the corporations to say that this is a problem that they should focus on. What we do basically locally is embarrass our local government. We do what we do with pennies, and then we turn around and say, well, just imagine what our local government could do instead of spending, for example, $500 million on police and prisons in Miami-Dade County as they do, or other frivolous things that, as someone mentioned, are media sound bites for their reputation or reelection campaign. And I'll say that, the time is now. I'm in environmental justice. I think that undergirds a lot of the things that I do. But crises are occurring every day around housing, around pay, around food, around energy and transportation. And so it's very easy for us to basically insert ourselves into a lot of different fights. And what we find is that they basically all connect to each other as well. And so I'm willing to sit with anybody who's willing to sit with me to connect the dots. And to talk about what we're doing in Miami-Dade County, because I really do think that it's a special thing we have going on here. And thank you again for having me. I look forward to talking with any of you in the future.
Well, thank you so much. Dr. Walks?
Thank you, Dr. Maxey. I will say that every election cycle, there's an opportunity to make friends with whoever comes into office. There are many times where we have, for example, in the state of Maryland, we are definitely going to have a new governor and a new attorney general and a new other this and a new other that. It's a new opportunity to say, this is what I've been doing. How can we work together and try to bring people in to successful things? When you've already done things that have worked, people want to be a part of that. I just know from being that public health official, from being that state health official that had to spend over $1 billion a year, I wanted to spend it in places that made sense. And I would look throughout the community for people who were positive, doing things, and had credibility in the community. And that's where that money went. So I just think it's important for us to not to do everything Barbara said earlier about getting out to vote and everything else, and at the same time be willing to look at the new people and not paint them with the same brush that the old people got painted with who didn't do anything. So thanks, Dr. Maxey.
Thank you, Dr. Walk. Dr. Neighbor Stevens.
I am troubled by the tenor of the sessions that we've had over the last several weeks. I am impatient because I'm not seeing, I may not have the line of sight, but I'm not seeing enough efforts being made towards connecting the dots. I am so thankful that Dr. Henderson was with us today. I am so thankful that people like Pastor Pointer have been on our show and have illuminated what they're doing in their communities. And I'm going to be thinking this week while I'm waiting out the hurricane about how can we be more effective in connecting dots? Because I know that there are pockets of activity all over the place, but we don't know what each other are doing, and we can't reinforce each other. And there's certainly strength in numbers. So I'm going to ask that all on the call today, if you have the heart and the mind to think about this, and offer up suggestions as to how Black Health Trust can help facilitate the linking of the dots and moving the needle and getting stuff done that needs to get done.
Well,
Well
thank
said.
you so much, Dr. Neighbor Stevens, and thank you for the program invitations today. This was your program dealing with these disasters, and I appreciate that. Simon, I sent you a set of slides. There are 2 slides I want to show, maybe 3, as my final comment. So, first of all, our next week's speaker is Dr. Now I have a mental block. He's the president of Meharry, Dr. Neighbor Stevens.
Dr. James Hildreth.
Dr. Hildreth, who I made his acquaintance this weekend. He is a world-class virologist, and Dr. Neighbor Stevens is thinking that he may get tapped to take over the National Institutes of Health, but he is a really, really great man, great scientist and administrator, and he is our keynote speaker for Sunday, October the 12th. Go ahead with those slides, Simon. So go to the next slide. So a day after President Biden said the pandemic was over, his chief medical advisor, Dr. Fauci, said we are not where we need to be if we're going to, quote, live with the virus, because we know we're not going to eradicate it. That's the very important point. So no matter what the president of the United States says, we are not over that virus yet. So the president's comments have complicated the fact that the administration still needs to have additional funding to continue to fight this virus. So it's very important that we listen to Dr. Fauci. We wish him well on his pending retirement from the federal government. Next slide. So we know that COVID-19 will likely remain a leading cause of death indefinitely, according to infectious disease experts, as reported on NBC News. And I want you to drop the other slides into the chat. If you would, you can put the slides down now. I want to comment that I wanted to get back to our medical advisory meetings. I'm planning one for the 12th of October, and we can discuss some of the items that have been brought up tonight of how we can effectively, to use Dr. Neighbor Stevens' word, connect the dots. And then we've got a major scientific lecture for the 26th of October, who is discussing type 3 diabetes. And type 3 diabetes, Dr. Walks, is Alzheimer's. And we're going to discuss some of that, the ways that that can affect the way that we treat people. And once we have that discussion with Dr. Ann Allen, we will probably bring her to our Sunday meeting. But I agree that we don't want to just talk and do nothing, but we want to get on the track and bring some action into all these great discussions that we've had. And I hope that all of our medical advisory members and those of you who will be on it come to that meeting. I'll make sure you get information out. Thank you, everybody, for joining us this Sunday. Have a great day. Talk to you later. Talk to you later, Dr. Clark.
Thank you, everyone.
And thank you, Simon, very much for everything you've been doing for us, and also to Skylar for doing our graphic art.